A woman is suing the British National Health System because she was not informed about inherited his father's Huntington's disease before she gave birth to a child. Later, she also found that the disease gene was passed to her, so that her child, who is now 9 years old, can also inherit the disease with a probability of 50%. And the National Health Service said that this case raises the question of how to harmonize the obligations of caring for the health of the patient and confidentiality. He was convicted of his wife's death, but was detained with the suspicion of insanity, through Huntington's disease, a fatal neurological disease that is progressing, destroys the brain. When this diagnosis was confirmed in 2009, the father of the woman very clearly stated that it does not want to know his daughter, because it was then that she told him that she was pregnant. He told the doctors that he feared that his daughter might kill themselves or get an abortion. She did testing that confirmed that she inherited the gene responsible for Huntington's disease. This means that over time, the disease will manifest itself and she also claims that in this case would be a genetic test and its results would interrupt the pregnancy, that her daughter had not inherited the disease and have not had time to take care of seriously ill mother. At that time she and her father took family therapy and, therefore, ABC considers, the doctors had to take care of her psychological and physical health. The interests of the patient really is the cornerstone in the relationship doctor-patient, but they are not absolute. Because the disclosure of personal information without the consent of the patient can prevent the risk of death or serious harm to their health. First, even in 2015, the case was considered by the High Court. The judge then refused a full hearing, because it did not see obvious negligence against the interests of the ABC as a patient. If the ARS wins the case, it would mean a serious change in relation to the privacy of the patient and also to the interests of family members of patients with genetic diseases and related tests. If the patient wants the doctor spoke to his children of certain diagnoses, for example, AIDS, the doctor, of course, have to respect the decision of the patient, says Emily Jackson, professor of law at the London School of Economics. The problem with genetic diseases is that they affect not only the patient but also carry risks for members of his family. In such circumstances, in the case when relatives are also taking certain decisions based on this information, it is not the responsibility of the doctor concerned in the interests of the closest family members of the patient, says the lawyer. However, as the speaker said, the hospital, which is suing ABC, this case is complex and sensitive as to how to combine care for the interests of the patient and his right to privacy. Let it be resolved by the court.